Okay, whenever you're ready.
As I seem to be experiencing considerable age-related dementia, I have made a few notes to help me ask your patients what I read from them. We've come a long, long way in dealing with HIV/AIDS. We used to find clients dying from what was at one time a death sentence. Now we live quite well by taking a few pills every day. I'm personally taking 14 pills a day. We used to have considerable ignorance relative to HIV/AIDS. Unfortunately, we still do. I can recall going on a speak to a local high school along with a public health nurse. She would do an HIV/AIDS 101, and I would speak as a person living with HIV. We always had a question and answer period following our presentation. One of the school jocks put up his hand and said, "You tell us we should have compassion for people living with HIV, but gays and people who are HIV positive aren't even human. How can we have compassion for them?" Well, I was, as you can imagine, quite taken aback by this, and I really didn't know what to say. So I simply replied, "I don't know whether you are or not. I don't know whether or not you know anyone who smokes," and a lot of them did. "But I hope you won't say you shouldn't have compassion for them when they come down with lung cancer." I was pleased with how many of his fellow students came up to me afterwards and apologized for the insensitivity of the question. Then there was a Barry judge who claimed that everyone knew that the HIV virus lived for several days and insisted on everyone in his court wearing a surgical mask. Imagine, if you will, being in that man's court. So we've come a long way, but we have a long, long way to go toward education. I'd like to thank all the volunteers who are associated with the center. Can you imagine what the budget would be if their hours had to be included in it? I'd also like to thank the staff who are doing this very hard and thankless work. And lastly, thanks to Jerry and his team for the many hours that they have put in working on ACSC and the Gilbert Centre for Social Services.